Well, some of the truths are not all surgeons are created equally. There are some well-intentioned, well-educated surgeons that just don't have talent. They're just not artistically gifted. They're not technically, their technical prowess is not good. Um, for me, if I can't make somebody look 25% better, I'm not operating on them. Because in that 25% is in my mind and in my head. I can say, look, there's a difference here that's worth going through the knife. Some of the other pearls are some of these non-invasive procedures that are just taking people's money. Um, and be careful with all these non-invasive procedures like fillers that are in the face, and you see all these patients with these cheeks that are pouty and full, and they look like somebody stuck uh, an air hose into their face. Um, that's fine, but my point to you in the pearl is fillers are not necessarily the answer to everyone, and everyone tends to look for a one-stop fix-it job that can fix everything, you know. But people age for several reasons, and there's some older people that haven't aged very much. They look great. So one of the pearls is not everybody's a good candidate for a one type procedure. It takes a number of different types of procedures that can improve someone's look, and if you only know how to do one of them, then you're shortchanging that person. One of the other pearls is that, and I frequently see this, is that, well, go to a subspecialist who only does eyes, or only does noses, or only does breast. I can tell you that a good plastic surgeon's a good plastic surgeon, and he's going to be good at a lot of different things. So most of the doctors that subspecialize in certain areas, in my opinion, do it because that's the only thing they know how to do. Doesn't make them better. Some of the other pearls is look at the patients in the waiting room of the doctors that you consult with. Uh, Talk your mind to the doctor. Tell him about what you're concerned about. Is one of the pearls. Uh, Safety should be the number one issue. Uh, the second most important issue is your results and what you can expect to achieve. Some of the other pearls are just because you see someone in a flight magazine in the airplane doesn't it says I'm the best. Uh, he or she may not necessarily be the best plastic surgeon, but he may be the best marketer. So be careful with the infomercials, the social media, because today it's hard to navigate into this realm of what's real and what's not real, and what's make believe, what's airbrushed, what's fake, what's photoshopped. So I'll leave it at that.